What is up, guys and girls? Stefan here, aka the driving safety medic. Hope you guys are having a smashing day. Hope you guys have been sort of enjoying the videos that I've been doing. I try and obviously make it as understandable and take out most of the technicalities, or simplify the technicalities for you guys, because I know sometimes this stuff can get like crazy technical. I mean, if you just look at the medical terminology, that on its own it's quite rough. So what I want to chat to you today, oh my word, what I want to cover today is triage. This is something that we did. I said in the previous video that I'm going to chat to you guys about, and here we go. So triage, as I mentioned in the previous video, excuse me, as I mentioned in the previous video, triage is the sorting, the decision factor as to which patient will be treated first, second, third, fourth, etc., in instances where you've got more patients than what you've got available first aid staff or medical staff. Now there's a couple of different variations on the triage. One of the more unknown ones is what we call triage sieve. This is when there is like crazy big amounts of patients versus the quantity of medical resources. But the general triage that you look at, or patient sorting that you will look at, is not that complicated. You've got four categories that you can place a patient in. Now, your worst case scenario is what we call a priority 4 patient, or depending on where you live, a blue patient. Now, the blue patients are patients that are deceased. Now, please remember, within the first aid environment, your declaration of death is only your declaration of death is only plausible if there is one of 4 things that occurs: decapitation, rigor mortis, obvious mortality, and blood pooling. So if any of one of those 4 is present, then the patient can be declared deceased. Now here comes the thing that I need you guys to just sort of ponder on. Yes, a first aider shouldn't be declaring a patient dead if there's no breathing and no pulse. But if I've got 2 patients and I am alone, one has got no breathing and no pulse, the other one has got at least a pulse but no breathing, which patient am I going to be treating? In that case, it is fair to say that you will then declare the no breathing and no pulse as a P4, blue patient, and you proceed to treat the other one. Okay, because the other one's likelihood of survival is bigger than what the no breathing, no pulse is. Okay, so that's blue patient. Your next patient, and yeah, I want you guys to think about depending on where you from where you're watching. Yeah, South Africa we call it a robot. I believe in America it's called a traffic light or a signal light or something like that. We've got the 3 colors. We've got red, amber, and green. Now think about that for me. This is for me a big thing. when I am looking at multiple patients and I want to classify a patient, what does red on a traffic light or robot mean? Red means stop. Now, your worst patients, your patients that need immediate advanced medical treatment or intervention, we classify as a red or priority 1 patient. And with this patient, we've got to stop, we've got to take our time, we've got to pay attention, we've got to provide a reasonable amount of care. Okay? Examples of this could be breathing difficulty, cardiac problems, open chest injuries, head injuries with localized signs, severe bleeding, amputations. All of those can be seen as your priority 1, P1, or red patients. Here we've got to stop, we've got to provide the necessary treatment. Your second one on the traffic light or robot is amber, or yellow, if you are happy to negotiate on the colors bit. The yellow means slow down, be cautious. Now, your yellow patients or priority 2 patients are patients that does need medical assistance, but their injuries are not immediately life-threatening. Examples of this: multiple fractures, spinal injuries, head injuries without localized signs, severe burns, what else? Closed chest injuries. Yeah, that's all I can think of off the top of my head right now. So those are the patients we're going to be treating second. Priority 2, second treatment, because they're not immediately life-threatening. Yes, it is serious, but it's not immediately life-threatening. Your third class, or your fourth class if you consider your blue P4 patients as number 1, I don't know, is on a traffic light green patients or priority 3 patients will get treated last. And the reason for this is they are the walking, talking patients. They are the patients that has got injuries, but the injuries is of no such nature or no such severity that they get preference over more severe patients. So priority 3 or green. Examples here, I don't know, minor bleeding, minor burns, minor fractures, what else? Minor shock. All of that can fall under your P3 or green patients. Now, maybe in the comments we can do this. I'll eventually, if I remember, put the answer in. Imagine you arrive at a scene, you've got 4 patients. The first patient that you come across has got no breathing, no pulse. So let's call it patient 1 or patient A, whatever. Patient A, no breathing, no pulse. Patient is obviously unconscious. Obvious, no breathing, no pulse. Patient will be unconscious, obviously. The second patient you come across is found that they've got a hip or pelvis fracture, as well as a fracture of the upper leg, aka the femur. Patient is in severe pain. Third patient you find lying on the side, and this patient has got burn wounds to his entire arm. No other visible or tangible injuries. And your last patient is running around screaming, oh, I bumped my toe. You see the toe is a bit blue when you have a look at it, but they are giving you a lot of verbal indications as to what is wrong with them, and they are talking a lot and everything. So what I want to know from you guys is these 4 patients. Firstly, I want you to say patient A you classify as priority 1, 2, 3 or 4, or you can use the color if you so want. Patient B, the dude with a pelvic and femur fracture, you classify as whatever number or color. C, patient with burns on his entire arm. And D, possible broken toe, like a phalange. What would you classify them as? Then the next part I want you guys to comment for me on is in what sequence would you provide treatment to the patients? Okay, what sequence would you first treat patient A and then C and then D and then B, or how will you actually sequence your training provision? In the next video I want to chat to you guys about setting up the triage area, especially looking within a disaster framework, because there's a big requirement for that. Anyway guys, as always, like, share and subscribe, the normal YouTuber expressions, etc, etc. If you want any other comment, drop it in the comments. No, if you want any other content, drop it in the comments. If you have any questions, put it in the comments as well, and then yeah, I will reply to it as best as what I can. Right, have a lucky day. Check you guys later.